My first guest, Kerrill Thornhill, founded MEG Support Tools with a view to enabling hospitals to spend more time caring for their patients, and he joins me now to tell us exactly how it works. Kerrill, prior to establishing this business, where had your career path taken you?
I'm an engineer originally, so I would have studied in UCD in the 90s. So I started out as a mechanical designer, engineer originally. I then moved into recruiting engineers in Australia for a few years. I worked in Northern Ireland in a manufacturing company. And probably in the noughties then, I decided to get involved in software. So I set up a software company and worked with my brothers, developing software for other people, things like the Irish Times app. And I learned about the software trade that way. And maybe about 6 years ago, I did my first job in hospitals, and I kind of got hooked on healthcare and how healthcare is kind of inefficient at the moment, and trying to develop systems and ways of improving the delivery of healthcare.
So specifically within healthcare, was there a particular problem that you were trying to address when you formed MEG Support Tools? And how prevalent is the issue within the healthcare system?
So I think the immediate thing I noticed kind of when I did my first job as down in Galway is just how paper-based everything was really, and people that were really highly qualified, you know, whether they're microbiologists or pharmacists or infection or nurses, they're really highly qualified people spending inordinate amounts of time on Excel or on paper-based systems. So it was just like, how do you free up their time so that they can actually spend more time with patients or more times on their jobs? It was just like, how do we work out how to limit the amount of time they have to spend in administration.
So how does MEG Support Tools alleviate this admin burden faced by many care practitioners in hospitals?
So probably some of the key things are, like, there are paper-based processes that hospitals do on doing hygiene standards, like collecting hygiene standards or checking are people washing hands, is the environment cleaning well, you know, these sort of checklists in healthcare are very important, and they could be around prescribing or different things. So it's taking all of those checklists out of paper and putting them onto, you know, really user-friendly mobile apps. Staff member can take out their phone and do their checklists on their own phone, and that creates a report instantly. Instead of going back to their desk and writing reports, it just does everything instantly.
Now, selling a product or service into the public healthcare system has proven to be notoriously difficult for many businesses. How have you found the experience to date?
I concur with what you just said there. It is notoriously difficult because it is difficult. It takes years. So you just kind of have to have a little bit of tenacity. Yeah, you have to kind of stay in the game for as long as you can, and make sure that what you're doing is driving. It's either going to save them money or it's going to improve patient outcomes, and you have to prove that. So you end up having to do like doing like conference papers or posters or trying to get research papers out there that show that the intervention you've made is going to make things different. And if you can prove that, and you put in a good business case, you can get adopted. But it does take 18 months, 2 years in a lot of cases to actually get a system.
And have hospital budgetary restrictions hindered your progress in that regard?
Oh, massively. Yeah. And I would say, so we're working with hospitals in the UK, Ireland, and around Europe as well. And it's not just in Ireland. Healthcare everywhere is underfunded. And I would say particularly in Ireland, there's a reluctance to spend money on IT. Everybody assumes that IT, you know, it's the last thing to get money. So, yeah, it can be, it's underfunded. Healthcare technology is well underfunded in Ireland. They need to spend a lot more on making sure, you know, that the infrastructure of technology in hospitals is better. Like, give people Wi-Fi, give them access to the tools they need. There's a legacy of underfunding.
And is there also a reluctance to change within the hospitals?
I would have said maybe 3 or 4 years ago that might have been the case, but what you see now is there's a real groundswell in staff and hospitals that they know what they're doing is really inefficient. It's frustrating in your job when you're working with really bad gear, and there's a real drive to improve how they're doing things. So I think that sort of reluctance to change is not as prevalent as it was.
And what's driving that change?
Just the desire to, you know, to make things better. Like you got, like, there are amazing people working within the HSE in Ireland. Really, people who want the best for patients. There's amazing talent, and I think the HSE gets a big bad rap a lot of the time on the radio. A lot of the publicity is usually negative.
Not just on the radio, by the way.
Oh, sorry, yes, I shouldn't say that. Right? But if you're going to listen to Pat Kenny or whatever, it's likely that a story about the HSE is a negative story, and there's just amazingly good, talented people. And I think they just want things to be run better. There's a real drive to improve things.
Now, if you've just tuned in, I'm speaking to Kerrill Thornhill, founder of MEG Support Tools. Kerrill, at present, what level of coverage does MEG Support Tools have in the UK and Irish hospitals?
We're in 45 hospitals. And that would be, we've got hospitals in London, Manchester, Glasgow, Cardiff. and we're all over the country. Like, so we have hospitals in Galway, Limerick, none in Wexford. So if you know anyone, give me a shout. And all around. So a lot of the main hospitals use our different versions of our system. You know, we've got a lot of different products that cover different things in healthcare. So we've got we're around the country.
Now, Karl, you are currently participating in the NDRC Accelerator programme. But aside from the investment, how has the business benefited from the NDRC programme to date?
I think anyone who's starting a business or has a business plan or an idea, something that they're evolving, it's really important to have the right mentoring and advice. And, so what it's done, it's given me a bit of space to be strategic. So it's time to think about what's our strategy for getting this. How do we make sure that we're building the right product? So we're always evolving and building new things, making sure that you're doing it effectively. So it's just time to get your strategy right. So the NDRC has a lot of very good advisors and people like that help you get that right.
So once you've completed the NDRC programme, what is the next step for your business?
So we're looking to raise money. So we'll probably be going out to raise investment funds so that we can scale it internationally. So we've added multilingual support for different countries, and we've taken on a new operations manager who's got really good international experience, working in France and Spain. So it's how do we just scale? And it's obviously healthcare is slow everywhere, so we need money to do that. So we're going to raise some money, hire key staff.
And how will you approach that funding round?
You write a business plan. You've got your projections, and and just be realistic about it, and know what you want to spend your money on, and know exactly how it's going to change the scale of your business or how it's going to change your trajectory, and hopefully find somebody that understands the market and that is the right kind of aligned investor to what we want to do.
And have you identified any potential investors in that respect? I know that the Halo Business Angel Network have a healthcare syndicate in operation across the country.
At the moment, it looks like we might be pitching with them in September, but it's not confirmed yet. So, and there are other individuals I know within healthcare. So, we have identified a couple of people, but it's very early stage. There's a little bit of a courting process when you're getting investors. So, we're just looking for the right one.
And do you plan to add further services to the business? And if so, what will inform the reasoning behind such an expansion?
Everything we do is driven by the people I'm working for, which are like hospitals, your quality managers in hospitals, chief pharmacists in hospitals, operating officers in hospitals. I just go out and I listen to them, and if there's a particular problem that I think we can solve, then I'll do that for them. But everything's driven by our customers pretty much.
And are you building the business to keep it or to sell it?
To keep it generally, but I think when you're in any software business like this, you need to make sure that your investors have an exit strategy, that people get their return on their investment and all of those things. So, that's to be decided. But I personally really like working in healthcare. I don't see me getting out of it anytime soon. I'm in here for the long haul, pretty much. And
what has been the greatest challenge that you've had to overcome to date in MEG Support Tools?
Bootstrapping a company, which means starting a company without funding, is really difficult. Not having any money, trying to find staff. It's incredibly difficult to set up something, and trying to build the right product, trying to get people to pay you. And the first 2 years were very, very difficult in terms of just staying alive, basically keeping the lights on. But I think once you get through, you have to have a lot of tenacity, and you have to have a bit of fight in you if you want to go and set up a company. And that's for any business, anyone out there. If you're going to go and do your own thing, you have to be ready for a fight, And finally, Karl, for any of our listeners that are considering starting a tech-based startup, what advice have you got for them? You really have to have good technical lead, or, it's very difficult to set up a software company unless you've got somebody on the team that knows how to write software in a way that's scalable. It's really important. You can outsource the work to other countries cheaply, but if you're not in full control of the technical stack that you're building, it's going to be hard to scale that. So it's just having the right group of people, having the right team around you. You can't do everything on your own. So find the right people to work with. So you need a very good technical person if you're not technical yourself. And if you are technical yourself, then you're probably going to need to find someone with a very good business head. So it's just about having the right people around you.
Well, if you've just tuned in, that was Kerrill Thornhill from MEG Support Tools, and we wish him every success in seeking investment for his company.